What is the time?
Sir, it is 10, sir.
10, okay.
Okay.
Start now. Very good morning, all of you. Good to have
Good morning,
Dean
sir.
Good morning, sir.
To have Dean sir and Ravi sir also with us. So, this is your topic today. So the last class was etiology of classification, etiology of malocclusion, and the different classifications of etiological features. So to continue and not to create confusion, we moved into the classification of malocclusion. So the classification of malocclusion, as I told you in the last class, you will get an essay from here also, define the classification and the various systems of classifications. Then most if you had seen the papers which are put up on your website, narayanagroup.co.com, that group, the last 10-year papers are there if you had seen. So this question is, after that it will be discussed in detail about Ackermann profit classification. It has come so many times, so be cautious. This also don't neglect. You might think just etiology and classification of malocclusion, but you will get definitely essays also, sometimes surprise questions. Of course, Ackermann profit classification you will see in the 4 marks more frequently. So the classification is nothing but orderly reduction of your entire database, which you collect all the sorts of records, okay, starting from your case history to clinical examination, then the whatever you take, do model analysis or whatever, and your cephalometrics. So the classification system, grouping of the clinical cases, then it can be used as a transcript also. So the occlusion, so the definition of the occlusion, the maxillary and mandibular teeth when the jaws are closed in centric relation without strain of musculature or displacement of condyles in their fossa. Okay, the condyles will be sitting in the fossa. They will not be displaced out of your TM joint. So those who want can just note down a few points, but as principal, I discussed with principal sir, sir was telling that this will be available on that YouTube channel. So from there also you can write down the notes. Now we can just listen. So the 6 keys, this we will get into the complete details. So the Andrews 6 keys of normal occlusion. Okay, the normal occlusion should have all these, all the 6. So this completely in detail we will get into during the chapter development of occlusion. During that chapter we will discuss in detail. So the line of occlusion I told you in the last class also, I showed you. We will not discuss this here again. So the malocclusion, so it is a deviation from your accepted normal occlusion. That is your deviation from your angle's line of occlusion. Okay? Angle line of occlusion, that which follows the angle's line of occlusion, is supposed to be normal occlusion according to the father of modern orthodontics. So this is a deviation from that. Okay. So one of the definitions you should be thorough. So So the classification, I will just introduce you to the different terminologies. We will just go through little faster, okay? The different terminologies, the individual tooth malpositions, okay? The mesial inclinations and the distal inclination, the lingual tipping, you can see there, the lingual tipping of your lateral incisor in the diagram, and even in the mandible, the lingual tipping of your lateral incisor. So the labial or buccal inclination or the tipping. See the labial inclination of the central incisor. And you can see the canine in the second figure. The canine is infra-occluded. Okay, it has got no space to erupt. So it is out of occlusion. That is infra-occlusion, and you have supra-occlusion. They have supra-erupted due to the malocclusion. Probably that should be a class 2 div 2 supra-occluded, and there is open bite. If you see the back, both the posteriors can see is completely out of occlusion. That is because of supra-occlusion. So the rotations, you have different types of rotations. Then the mesiolingual and distolabial. Then you have transposition. This I told you in the last class also during the discussing your Graeber's local factors. So the transpositions, you can see the canine, as I told you in the last class, it was the most commonly transposed tooth, your canine. Then you have the malrelation of arches. So the malocclusion, you should view it in all the three planes. So any malocclusion you will have to, it will be there in the three planes. So we have to identify where is the problem is in which plane. This we will discuss towards the end of this topic today. So the overbite, this is your overbite, okay? The incisal margin closes vertically past the mandibular incisal margin, okay? The most important thing is when the teeth are in habitual or centric occlusion, okay? So the centric relation and centric occlusion, you should be very, very thorough. I told you in the classes also, you have written the definitions also. Probably it will be there in your third year notebooks. You'll just have to refresh. So the centric relation, centric occlusion, you will be hearing lots in the prosthodontics also. So the same here, this is overjet is horizontal measurement. That is your overjet. This is your overbite, the vertical overlap. So the bite, there will be a space. Space exists between the occlusal or incisal surfaces. Last class we have seen what happened during your tongue thrusting. Okay, so that is your open bite. The thrust causes open bite of various degrees. Okay, so you should be thorough with your classifications of tongue thrusting. All the habits will be detailed. It will be covered in detail in the periodontics department also. So with the open bite, you should know the various degrees of open bite. That is to identify the treatment plan. By the etiology, then we decide on the treatment plan. So the closed bite or your deep bite. Deep bite, this mostly you will see in the div 2 cases. Class 2 div 2, complete deep bite you will see. Okay, this is just excessive overbite. So the cross bites, you will see just one or two teeth are in abnormally malposed. Okay, buccally or lingually or labially. When you come to the anteriors labially, so they will be abnormally malposed. So it is just pertaining to couple of teeth or a single teeth. But the scissors bite, you can see here the scissors bite, the entire segment is out. Okay, that is called the scissors bite. Okay, the entire maxillary buccal cross bite will be there. Okay, So don't mix up your scissors bite and your cross bite. So the vertical plane, of course, the deep bites are the vertical. So the entire cross bites are in the transverse plane. Cross bites are in your transverse plane. So we use all the expansion, all the different types of procedures to correct your transverse malocclusions. Then you have the skeletal malocclusions. So finally, we will get into the details of your angles classification a bit later. First, we will see why you should classify. So the need for classification, you can see this the list here, the grouping of the orthodontic problems, then the location of the problems, then you, of course, all of you know, you need to diagnose and for treatment planning. Okay, classification is very, very important for diagnosis and treatment planning. In many of the departments, the classification is, that is why it is necessary. The comparison of different types of malocclusion, the class 1s, 2s, 3s, and divisions and subdivisions. This is all very, very important. So and also for self-communication. When we talk to some of your colleagues, you will be telling me he has a class 2, he has a class 1. So that's for your self-communication. Then the documentation, of course, for the records. Okay, that is very, very important in orthodontics. So for the record purpose. Then, of course, the epidemiological studies, what mostly it is done in the community departments, but also even in the other departments also some epidemiological studies are done, and also to assess the treatment effects. So that is the purpose of your classification. So what are these classifications? You have qualitative and then you have quantitative methods. So today we will be, the entire chapter today is on qualitative methods of classification. Quantitative is entirely different. So the quantitative, you can see the list. So we will be taking care of the left side, okay, the qualitative methods. Then this is the quantitative is, it will be taken care in the community department, indices. These are the orthodontic indices, okay, the irregularity index, TPI, IOTN index, or the PAR index you might see in the papers sometimes. So coming to your qualitative methods, we will move into today's main heart of the today's class. The angles to Weiss, Simons, the Ackermann profit are very, very important for you. Okay, that you will see in the, these are all the different etiological classifications, various systems of classification. This we don't need, you don't need all this. So the angles, father of modern orthodontics, he has given these 3 classes in the year 1899. So the angles classification, the landmark year, that is 1899. Okay, so the 1, 2, and 3. This is in a nutshell. This slide, if you see, everything is here. The class 1s, class 2, again divided into division 1, division 2, and there are subdivisions. The subdivisions are there. Then you have the class 3 malocclusion, the class 3, you have the true class 3, then you have the pseudo class 3. Then of course the subdivision is nothing but if you have the malocclusion only on one side, either right side or left side, then it is called a subdivision. Okay, for example, the div 2, it is again subdivided to type A, B, C. Okay, based on the anterior relationship, the incisor relationship. So the angles classification based on the first permanent molar relationship. Okay, so the angles class 1. Okay, the mesiabuccal cusp, you can see there, the mesiabuccal cusp occludes in the buccal groove of the mandibular first molar. That is said to be your class 1. Then you will have various things. In the class 1, you have crowding, spacing, rotations, and the missing tooth. All this will be there along with your class 1 molar relationship. So the class 2, you have the division 1, division 2, and subdivision. Okay. Here you can see the mandibular molar is stable here. Molar is stable. Only thing, the maxillary molar is moved forward. Class 1 is your mesobuccal cusp. So the class 2 is your distobuccal cusp, including in this buccal groove. Okay, that is your class 2. Then all the features of class 2. So the differences between div 1 and div 2. Very, very frequently seen in the papers. The class 2, div 1 and div 2, you'll have to know all the different features. Okay, this is your div 2. Class 2, div 2, you are not able to see the lower incisors. So the upper incisors are in complete overbite. Okay. See here, the div 2 molar relationship is same, but the anterior relationship will change. Whereas in the div 1, you will have severe overjet, severely proclined anteriors, and the retruded lower incisors also. So the division, subdivision, as I told you, you will have it on one side. Okay. When you have it on one of the sides, right or left, that is called a subdivision. So the div 1 and div 2, you can see this is the table. Okay, if I remember, most of you have written this, the division 1 and division 2. So the differences you should be able to put down. This is a frequently seen in the 4 marks area. Okay, or you will find in the 2 marks area also. See the profile, okay, convex profile. Here also almost slightly convex, or it will be, usually it is orthognathic. Okay, orthognathic is nothing but straight profile. Okay, so the lips are incompetent, whereas div 2 you will have competent lips. Okay, so the mentalis will be hyperactive. Mentalis will be very, very hyperactive. Patient will not be able to close the mouth because of the severe proclination of the maxillary incisors in the sorry for that, some technical problem we had. So the R shape, the palate. So the palate is very deep in the div 1 cases. Then you
Sir? Sir?
So the class 3 malocclusion, you have the pseudo class 3 and you have the true class 3s. So the difference, you can see the difference between your pseudo class 3 and true class 3. There is normal class 1 skeletal base. There will be only functional problems due to the functional shift. That is called your pseudo class 3. Then the true class 3, there is severe skeletal base itself is in a class 3. Okay. So the drawbacks of your angles classification, it is only considered in one plane. So coming to the modifications of your angles classification, you have all these classifications, but the main thing is Dewey's modification. This is seen in the papers regularly. The Dewey's modification, it has 3 classes. It is again divided. He again divided angles class 1 into class 1, class 2 and class 3. Class 1 has 5 divisions based on the different characteristics, okay, or the intraoral characteristics, most of it. Then the class 2 has no modifications. Then the class 3 is again modified into type 1, 2 and type 3 based on your relationship of the incisors. So the Baum's classification, this is nothing but your primary dentition. You should be able to, I already told you, the development of malocclusion. Baum has given this straight or flush terminal plane, the mesial step or the distal step. So mesial step is your class 1, or it can again modify by the time it moves to the permanent dentition. It might be a class 1 or class 3, the mesial step. So the distal step will be a class 2 as it matures into from the mixed dentition and the different transitional periods of your mixed dentition as it goes into a permanent dentition through entire process of your development of occlusion that will happen. Okay. So the Ballard's incisor classification is also there, but the most important incisor classification will come at a later stage. That is your British Standards incisor classification. Okay, this is not that very important. Bennett's classification. This is a regularly seen question in the 4 marks area. So the Simon's classification, it was also seen in one of the postgraduate papers also. The Simon's classification, Simon has used your mathodynamometer. Okay, that instrument he has used. Sorry about the technical problem, something is popping up. So the Simon's classification, he has used 3 planes, the FH plane, the orbital plane, and the mid-sagittal raphe. So the Simon's classification, these 3 planes are used. So he has developed different. So the Simon's orbital plane, he has used the orbital plane, the second plane. So the Simon's law of canine, it is also called the law of canine. It is very important. They will be asking you in the Viva what is the law of canine. So it is given by Simon. The orbital plane passes through the distal axial aspect of your upper canine. Okay, that is your Simon's law of canine. Then you have the mid-sagittal. Based on this, he has given protraction and retraction. So the mid-sagittal plane, that is your transverse plane. Okay, the plane is determined by the approximately 1.5 centimeters apart on the median raphe of the palate. This is the third plane. He has given, based on this, he has given the contraction or the distraction. So this is what, so the Simon's classification, you should be able to put down the year of the classification, the instrument used, then you will have to talk about the three planes, then you will have to mention what was the inference from the three planes, what he has given. So this slide is very important. So all the classes will be uploaded in your the YouTube. Okay, I think all of you know the YouTube. You must be watching the other department classes also. So from there you can again go through and make some notes if you want. So the skeletal classification is not much important for us now here. So the activum and profit classification. This is very, very important. So mostly if you see a question on classification of malocclusion, that will be on this classification. So the activum and profit classification, it is based on